Hi, let's see an NCLEX RN video on assessment of reproductive function. The nurse understands G2P0111 indicates which of the following? 2 pregnancies, no full-term pregnancy, 1 preterm birth, 1 abortion, 1 living child. 2 pregnancies, no preterm birth, 1 full-term birth, 1 abortion. 2 children, no abortion, 1 preterm, 1 full-term. 2 children, no abortions, 1 full-term pregnancy, 1 preterm pregnancy. So G2P0111 indicates 2 pregnancies, no full-term pregnancy, 1 preterm birth, 1 abortion and 1 living child. G, that is gravida, that is the number of pregnancies regardless of duration. Parity, that is the number of past pregnancies that have gone to viability and have been delivered. Parity can be further delineated into TPAL. T is full term, P is preterm, A is abortion, which can be spontaneous or induced, and L is living children. Which statement by the patient indicates teaching has been effective in regard to her pap smear? I have to have this done every year even if it is negative, right? This is a test to see if I have cervical cancer. This is a test for ovarian cancer. This will test for the HPV, right? A pap smear is a test for cervical cancer, not ovarian or for HPV. If negative, pap smears can be done every 3 to 5 years. So the statement, this is done just to see if I have cervical cancer, is the correct option. The nurse instructs the patient to avoid which of the following prior to the mammogram? Food and drink for 12 hours, deodorant or creams, vigorous exercise, aspirin or non-steroidal anti-inflammatory drugs. Deodorant or creams should be avoided. Food and drinks, exercise, aspirin or NSAIDs are okay. Which statement indicates teaching has been effective in regard to PSA testing? PSA is prostate specific antigen. I don't need a PSA test if that digital rectal examination is negative. I understand the new recommendation state men should have a PSA done annually. I may need an MRI if my PSA level is high. Typically, the PSA and digital rectal examination are evaluated together. Both the digital rectal examination and prostate specific antigen testing are evaluated together. Recently, the recommendation for annual testing has come under review because of questions of accuracy. There have been instances of men with elevated PSA levels who do not have cancer, resulting in unnecessary biopsy and treatment. There are also instances of men who have normal PSA levels who do have prostate cancer, resulting in inadequate treatment. Routine testing should be done after conversations with the provider, taking into account age, patient history, and any other pertinent factors. An MRI is not indicated with a high PSA. If suspicious, biopsy is indicated. As men age, their reproductive ability does which of the following? Declines, increases, remains the same, disappears. Reproductive abilities remains the same as men ages. The patient asks a nurse what part of a vulva is where orgasms occur. The nurse understands the principal location of sexual pleasure for women in which of the following? Clitoris, hymen, vagina, introitus. The clitoris is the principal location of sexual pleasure for women. The vaginal orifice is called the introitus. The hymen is a thin membrane that can completely or partially cover the vaginal orifice if present. The vagina is a muscular canal that connects the uterus to the exterior of the body. The nurse understands the luteal phase of menstrual cycle is accompanied by what hormonal changes? Low levels of estrogen and progesterone, increased levels of progesterone and estrogen, increased levels of estrogen and LH, increased levels of FSH and estrogen. The follicular phase is when the ovaries are the least hormonally active, resulting in low serum estrogen and progesterone concentration. Estrogen levels peak on the 12th day of cycle, resulting in a surge of LH. This is the beginning of luteal phase. So here increased level of estrogen and LH occurs. If fertilization does not occur, there are gradual decrease in LH which lead to decrease in progesterone and estrogen production. Ultimately, the drop in estrogen and progesterone leads to sloughing off of the endometrial lining known as menstruation or the ischemic phase. The negative feedback loop involved in spermatogenesis is facilitated by what hormone? ICSH, which is the interstitial cell stimulating hormone, which is the other name for LH. LH, FSH, inhibin hormone. The testes contain primitive sex cells called spermatogonia. The spermatogonia are located in the seminiferous tubules. Inside the walls of the seminiferous tubules are Sertoli cells or the nerve cells. These cells form a protective envelope around the immature sperm cells. They are stimulated by FSH and secrete nutrients that aid in process of meiosis and the development of mature sperm. As nutrients become depleted, the hormone inhibin is secreted from the Sertoli cells, sending a signal to the anterior pituitary to slow the release of LH. As with female hormonal control, this is a negative feedback loop that helps to control the production of sperm. Inhibin hormone is the negative feedback loop involved in spermatogenesis. Assessment of the male and female reproductive systems include reproductive history, electrocardiogram, abdominal CT scan, physical examination, laboratory markers such as PSA. An ECG is a part of cardiac workup. An abdominal CT scan may be done if the patient presents with abdominal symptoms, but it is not a part of regular reproductive work. So here, for male and female reproductive system assessment, reproductive history, physical examination, and laboratory markers such as prostate specific antigen needs to be assessed. Cinda, a 29-year-old Gravida 2 Para 1011. She is here today for her gynecological examination. Her last gynecological exam was 2.5 years ago after the birth of her child. Cindy states that she has not had a period in 3 months and complains of unusual fatigue. Home pregnancy test that was negative. In addition to her fatigue, she also complains of cold intolerance and a noticeable increase in weight. She could possibly be pregnant despite her negative home test. Laboratory testing to be done includes serum pregnancy test along with prolactin, FSH and LH. A laboratory sample for thyroid stimulating hormone is also sent to evaluate her fatigue, cold intolerance and recent weight gain, which may be signs of hypothyroidism. Speculum and bimanual examinations are done. A pap smear is obtained along with cultures for gonorrhea and chlamydia. The remainder of her examination is unremarkable. Cindy's serum studies are unremarkable except for a slightly elevated TSH level. She states her desire to get more information about long-term birth control. She is encouraged to follow up with her primary care provider regarding her slightly elevated TSH level because it may indicate hypothyroidism, which would account for her fatigue, cold intolerance, irregular menses and weight gain. It could also affect her ability to get pregnant should she wish to. Cindy should also take medroxyprogesterone 10 mg daily for 5 days to stimulate shedding of the endometrial lining. When the endometrial lining builds up without shedding, a cancer can develop. The menses following the medroxyprogesterone treatment will likely be very heavy, and Cindy should be forewarned about this. The nurse includes which information in teaching plan for Cindy? Follow up with your primary care provider if this fatigue and cold intolerance continues. The use of condoms as a birth control method. The use of an at-home pregnancy test is a satisfactory way to confirm pregnancy. Make an appointment with your primary care provider within 2 weeks. The reason for the medroxyprogesterone treatment and what to expect. Cindy should follow up with her provider about her increased TSH even if the fatigue and cold intolerance subsides. Although they can be effective if used correctly, condoms are not the best method of birth control. Home pregnancy test should be confirmed with a urine or serum pregnancy test. It's also important she understand that she is prescribed medroxyprogesterone because she has not had a period for 3 months, which has a cancer risk. Also important, the associated endometrial lining shedding could result in heavy bleeding. So the nurse should make an appointment with the primary care provider within 2 weeks, and the reason for medroxyprogesterone treatment and what to expect. Which statement by Cindy indicates teaching has been effective? I wish condoms were more effective. I don't like to take pills. I will make an appointment to see my provider soon to follow up on the TSH levels. This thyroid problem won't affect me if I want to get pregnant. I am feeling better. I don't need to see my doctor. So here the second answer, it indicates Cindy is aware she needs to follow up with her provider. Again, condoms can be effective if used correctly, but they are not the most effective means of birth control. Hypothyroidism may affect the ability to get pregnant. The nurse indicates which of the following in discussion about birth control. Progestin-only birth control pills decrease the risk of blood clots. Intrauterine devices protects against sexually transmitted disease. Condoms are very effective when used correctly. Hormone-releasing patch lowers blood clot risk. Progestin-only birth control pills decrease the risk of blood clots. Intrauterine devices provide no protection against sexually transmitted disease. Condoms are effective but not the best form of birth control. Hormone releasing patch increases the blood clot risk. Cindy begins to have very heavy bleeding with her periods. She is scheduled for a hysteroscopy for evaluation. Which statement by Cindy indicates teaching has been effective? I'll be able to resume normal activities the same day as the test. I will have to abstain from sex for a few days after the test. I am glad I'll be able to eat and drink prior to this test. This is a test that can be done in doctor's office. Hysteroscopy is an invasive surgical procedure that is done in a surgical suite. Patients are NPO prior to the procedure. Discharge teaching should include at least 2 days of rest post-operatively and nothing in the vagina for 4 weeks. So here the teaching should include, I will have to abstain from sex for a few days after the test. Cindy understands the hysteroscopy is being done to evaluate her for which of the following: the presence of fibroids, an HPV infection, a molar pregnancy, the presence of an abscess. Hysteroscopy is an invasive surgical procedure that allows for direct visualization of the endometrial cavity via a fiber optic scope. The hysteroscopy can be interventional as well as diagnostic, allowing the resection of endometrial polyps and intracavitary fibroids. Laboratory testing such as Pap test evaluates for HPV infection. An abscess should be suspected if Cindy has signs of infection such as fever and foul drainage. Diagnosis is done through physical exam and laboratory testing. A molar pregnancy is most typically discovered when a miscarriage occurs and can also be detected through ultrasound. So here it is for the presence of fibroids. Hope you understood this video. Thank you for watching. Please do follow.